Hey, hi everyone. I hope you can see and hear me. Hi everyone, I'm Kim. Thanks for coming to our virtual fireside conversation, Voices of Thalassemia. So before we move on, I would like to introduce the people who will be speaking today. We have from Malaysia, Fazlina. Aslina. Okay, and we have, of course, the acting president of ATF, Sui Hong, Madam Khoo Sui Hong. Hi, Sui Hong.
Hi, hi.
Okay, and we have from Indonesia, Aditya.
Hello, everyone.
And of course, last but not least, we have Dr. Lisa, who is actually the brains behind this whole event. Hi, Dr. Lisa. All right, so thanks everyone for coming in. Sorry, we're a little bit late. We ran into some technical issues, but we are ready to go. So before we do anything, oh yes, wait, I have to thank our organizers. So our the company supporting us, for the pharmaceutical company supporting us with this technical and education for thalassemia will be One Pharma Marketing Inc. Let's thank them. Let's give it a virtual clap. And of course, the Asean Thalassemia Federation. And then we have from Philippines, Thal Action Network, right? And then the Philippine Society and Hematology of Blood Transfusion. And of course, the various thalassemia organizations all across Southeast Asia. Yeah, so all thanks for your participation for this event. Okay, let's move on to the event. Before we do, we have a video to show you, and this video is from TIFF, uh, the headquarters for thalassemia, right? So let's watch the video.
Dear friends and colleagues, on behalf of the Thalassemia International Federation, I extend the warmest greetings and heartfelt solidarity to the Asean Thalassemia Federation, its leadership, partners, and the entire thalassemia community across Southeast Asia on the occasion of the Voices of Thalassemia, Patients and Parents Championing Change virtual gathering. Patients and families' strength, resilience, and unity are at the forefront of TIFF's advocacy, awareness, and meaningful changes by creating a platform that amplifies lived experiences and fostering a productive dialogue among patients, parents, healthcare professionals, and organizations. ATF can indeed play a vital role in advancing patient-centered care and in empowering communities across the region. Dear friends, Thalassemia International Federation particularly commends the focus of this event on recognizing patients and families as equal partners in care, in decision-making, and on advocating for meaningful improvements in quality of life and social inclusion. Their voices and active engagement are essential elements and prerequisites for shaping disease-specific policies within healthcare systems and for ensuring that these policies indeed effectively reflect real needs and lived realities. Dear friends, at the same time, it is essential to acknowledge that significant disparities persist among ASEAN countries in the level of care and management of thalassemia, as well as in access to safe and effective therapies. While some countries have indeed made notable progress, others sadly continue to face immense and multiple challenges in ensuring equitable and comprehensive care such as those recommended in international guidelines. Addressing these gaps effectively requires sustained regional collaboration, knowledge sharing, and unified advocacy efforts. In this context, Thalassemia International Federation reaffirms its strong and unwavering commitment, sustained over decades, to supporting the Asean Thalassemia community. We stand ready to strengthen our collaboration with ATF, and should its members be willing, we would be honored to welcome ATF under the patronage of TIFF. Such a partnership would aim to enhance regional advocacy, support capacity building, promote productive collaboration among all stakeholders, encourage the adoption of international standards of care, and facilitate improved access to quality and innovative therapies, which are here with us today, authorized, made accessible and affordable for all patients in need across ASEAN, as in other parts of the world. As we mark this meaningful gathering today, aligned with the spirit of International Thalassemia Day, observed annually on the 8th of May, let us continue to work together on this lifelong challenging journey. Patients, families, clinicians, healthcare professionals, by extension, administrators, industry, and organizations alike, to build a future where every individual with thalassemia, regardless of where they live, has access to optimal care and the opportunity to lead a full and healthy life, ensuring that no one is left behind or left in silence. TIFF remains at your disposal as a reliable, continually updated and approved source of knowledge and education on relevant information. Thank you for giving us the opportunity to address this event, and congratulations for all your achievements. Dear friends and
Okay, thank you, Dr. Androla from TIFF, for her video message. And then now, of course, we cannot miss out our host country, Dr. Lisa, to give us a few words about the rationale of this whole event. Dr. Lisa, please.
Thank you, Kim. In behalf of course, the Asean Thalassemia Federation, and being the host country, in behalf also of the Thalassemia Action Network of the Philippine Society of Hematology and Blood Transfusion, we welcome everyone. In the Philippines, we welcome you with our words, mabuhay, meaning we face each other's challenges together. And why we are even here is because we know in the ASEAN region, we almost share the same experiences, the same advantages, or mostly disadvantages, as well as barriers. And we feel that there are so many lessons that we can share with each other. And beyond the lessons is to really provide hope that despite all the challenges we are facing, I think together we will have a stronger voice. That's why the first session of hopefully many is to use this effective platform to really reconnect with each other and uplift each other in the process. So I think this is a challenge we are posing to everyone: is do not keep your stories, because those stories are hope for each other, especially in the thalassemia community. So again, welcome everyone, and we hope to hear and be inspired tonight. Back to you, Kim.
Hey, so we're going to introduce our panel. We do have a set of questions that we're going to answer, and we are going to ask our panelists will answer this set of questions. Feel free to ask questions. If you are shy to turn on your video or turn on to speak to us, you can actually type out your questions in the chat. Okay, so if you have questions, please ask. Now's the time to ask. Okay, so I will introduce our panel. We have Faza from Malaysia. We have Sui Hong, also from Malaysia, and we have Adi from Indonesia. Yeah. Okay, so do we put the questions in the chat, or do we? Okay, so let me read out the first questions. Okay, the first question is, what was the turning point that inspired you to advocate for thalassemia? Panelist.
Okay, so Hello everyone. I will be the one who actually answering on behalf of Mr. Ruswandi because at the moment Mr. Ruswandi is not available due to the medical condition. So me, Aditya, representing the Indonesian Thalassemia Foundation, would like to thank you, and it's an honor for me to represent Mr. Ruswandi on his behalf. And of course, I would like to thank you to the Philippine Society of Hematology and Blood Transfusion, the society and all of the institution that actually supporting this wonderful event. And also the Asean Thalassemia Federation member of countries, yeah, from Malaysia, Philippine, and other countries, Singapore, and other countries as well. Actually, there's one video about want to highlight Mr. Ruswandi before we want to go to answering the question. Um, do you have the video to be presented, Kim, or just like answer the first question?
You want to show the video first, right? Angel? Maybe they need time to
All right. Okay.
get the video.
Okay. So I'll just like explain about the first question, yeah, about what was the turning point that inspired Mr. Ruswandi specifically in was it to advocate thalassemia in Indonesia? Well, I've been side by side with Mr. Ruswandi since 1992, basically. So it's like a long, long time because one of our, well, actually, my cousin, first time diagnosed, which is the third son of Mr. Ruswandi, was diagnosed of thalassemia in year 1980. So back then, there are very limited information about thalassemia, and then not even limited, there's no information about this particular challenges. Yeah, I mean, like thalassemia, how's the treatment, what it is. So all of the effort being done, it's a self effort in finding all the information, but not only in Indonesia, but also in other countries as well. So Mr. Roswandi started to find all the information, starting to get how to get a proper treatment, how to access a good quality of treatment as well. But then it comes another challenge, yeah, in Indonesia, access of funds as well. Then there's another challenge about access to get the treatment, another challenge in access to get the medication, the blood transfusion. So back then, one challenge followed by many other challenges. Yeah. Um, Not to mention that, Mr. Ruswandi has been witnessing, because Indonesia is such a huge countries, it's a huge archipelago. There are a lot of families that actually come from low economic income back then, yeah, up until now, basically. And then these challenges actually being faced by families in Indonesia. Not only funding but also education. Indonesia now there are a total of 38 provinces, more than 500 regions, and also consists of thousands of islands. Can you imagine? And those thousands of islands mostly is actually inaccessible. Yeah. So those issues, yeah, even one of the biggest challenges is actually, of course, the treatment expenses. There are a lot of families that cannot get the proper treatment because of the finances. That is one of the this actually the first effort that Mr. Aswandi built and established the Parents and Patient Association in 1985, together with the Indonesia Thalassemia Foundation, so that we have the legal entity to do the advocacy And then we more than 30 years we've been fighting, knocking doors to doors, both private and government sector to have this treatment being insured. And finally, the struggle and the fight paid off in 2011. Uh, Thalassemia treatment in Indonesia fully covered by national insurance. So that's more than 30 years fight, and I was there, and I've been in the process as well. And yeah, it's finally paid off. And then back then, the patients probably around 3,000 patients, yeah, in year 80 and 90s. As we speak, based on our data, now total patients in Indonesia reach 15,068. Yeah. This information actually gathered from our organization. Our organization keeps on growing. Now we have total of 68 branches across Indonesia. So we work and fight together. Now we are focusing on the prevention programs. So those are the key driven factors why Mr. Iswandi keep on advocating thalassemia in Indonesia. So yeah, that's the I believe I have hopefully cover everything. Yeah. So back to Kim.
Yes,
Thanks everyone.
thank you.
Yeah.
So, Aditya, the video is ready. Would you like to for the video to run?
Yeah, they'll be great. So our team actually created this video to appreciation to Mr. Ruswandi because I believe that he is the icon, he is the beacon, about this thalassemia advocacy in Indonesia. There's nothing else. Yeah, hopefully, well, again, he's now in not in a good shape, but our prayers is for him to keep on going for the advocacy. So yeah, please do present the video for Mr. Ruswandi. The sound is not on yet. Sorry.
Okay, so thank you for the video, very inspiring. So
Yeah.
yeah, I learned that Mr. Ruswandi started this whole advocacy for thalassemia because of his son. Okay, anybody else would like to share? Panelists, anybody else want to share their turning point to advocate for thalassemia?
Well, for me, it's the same story, I guess. I had Janice in 1983. The same scenario. There's nobody knows what's happening. I guess it's the same everywhere. I did a lot of homework and a lot of research, and I tried to give her the best available at that time in 1983. But then I realized that all the other towns are not getting the same. They couldn't afford the same. So I had no choice but to start an organization to raise funds so that everybody in every other thalassemics in Penang is able to get the best treatment. And that's what started the Penang Thalassemia Society. So right now, in Malaysia, in fact, most states have got their own thalassemia society. I'm now involved with the National Federation of Thalassemia Societies of Malaysia, which is an umbrella for all the other state societies. So our aim is to advocate the same level of treatment for every state. So every thalassemic in Malaysia should have the same level of treatment. It's hard to do that, but we hope we can achieve that. And I guess the same with the Asean Thalassemia Federation. You know, in the end, we would want the same treatment, the same quality treatment for every thalassemic in ASEAN, which is like a humongous task. But if we don't start, we can never get there. That's about it from me.
Well, we can see a common red thread.
Yeah.
Parents actually the ones that started associations, right? Because they see a need for it. They see a need for advocacy or whatever it is. Yeah. So I know Faza is also advocating for Thal in Malaysia. Yeah. If anything to add.
Okay, now from patient view, actually first, I've been forced to join the society, to be honest. After I graduate, our chairman asked me to be an assistant secretary. That's the starting point. And then slowly I fall in love with it. Okay. And then I see along my journey as a thalassemia patient, it showed me that many people still know very little about thalassemia. And then I realized that as a patient, I can share about my disease. I mean, sharing my experience about to other patients, so that at the same time, patient they can learn from each other, because I think that sharing is always the best way for us as a patient to know better about our disease. And then that's why I start to do camp, because I want more we call it professional patient, because I know it's very important, because it's happened to me before. When I admitted to ICU, I know that time education, the knowledge about your own disease is very, very important. So at that time, I think that what other patient will do if they have no knowledge on thalassemia. So that's really opened my eyes that time, that I need to do something. We have to have more professional patients in not only in Malaysia, of course in other countries as well, so that they can protect themselves, they can take care of themselves, because we cannot rely 100% because to the doctors, to the medical staff, because at the end we need to take care of ourselves also. Yeah, that's the starting point for me to involve in patient advocacy.
Thank you, Faza. Okay, we will move on to the second question. Okay, so the second question is, what challenges do families face that are often unseen by others? What challenges do family face that are often?
Okay, I guess I'm the one to address that, right? Because I'm the only mother around, right? Challenges, the unseen ones by the professionals, is the family dynamics. You can have one kid that's thalassemic and you can have a few others that's non-thalassemic, but obviously you're going to spend more time with the thalassemic because of the hospital stays, the transfusions, the management and all that. So it's a fine balance how to be able to treat every single child equally. I'm sure that there will be some that feels that they have been sidelined, the non-thalassemics. But on the other hand, we need, as parents, we need the hospitals and the staff to understand that time spent in the hospital is very disruptive for the family. And many cases whereby when they cannot finish the blood or they started the blood late, on that day, and they cannot finish on that day. And they just simply say, you can always come back tomorrow, right? Well, the parents are working. They have to take more leave. Sometimes they don't even have leave to take anymore. So, and the thalassemics themselves might be working. So it's already hard enough for thalassemics to get a job. And for a thalassemic to keep on getting leave to go for transfusion is not going to help them in their career. So we need to see the other side of the coin. So we need to work as a team to understand both the families living with thalassemia as well as the people who are treating thalassemia. That we cannot ask them to, oh, come back anytime, like come back tomorrow, come back the day after, because they don't have that kind of time if you want them to be successful. The reason we are treating them and making them grow and making them healthy is because we want that to assimilate them into the normal population. But if they have to keep on getting leave for management that unnecessarily, they're not sick, they're just going in for blood transfusion for a top-up, you know. Ideally, they should be able to get out of hours transfusion, whereby they finish work, they come to the hospital for transfusion, but we are not able to achieve that yet. So.
Yeah, actually, I agree with Swee Hong about the scheduling of, you know, how many doctors visit I have.
Yeah, and all the different departments, right? Yes. The eye, the ear.
Yes, I open my hospital app and I see a whole long list of appointments, and I go like, oh my God, how am I going to fit my life into that?
Yes, exactly. So that's the part that maybe we need to highlight to our carers, to the medical team. You know, it's not that we don't want to, but if you want us to be successful and we want us to have a career, something has to be worked out so that it works both ways, you know.
So yes, one of the many unseen challenges. Yeah. Anything else? Anybody else have anything to say? Audience as well, please chip in. If you feel like something has been overlooked, or you know, you want to share something, your struggles, please do so. This is a very good platform. You can share with us. Okay, while we are waiting for responses, we can move on to the next question, and we can come back to this question if there's something. So the next question is, how can patients and parents influence awareness, access to care, and policy change? How can parents and patients influence awareness, access to care, and policy change?
Okay, let me talk first as a parent, then I'll pass over to you all as thalassemics. Okay. Parents need to encourage their children to be visible, to be more active in their support groups. Ultimately, the societies belong to them, not to the parents. What the parents want might not be what the thalassemics want. You know, so it's up to the thalassemics to be active and to show policymakers what works for them. It's not what works for the parents. So the parents can only guide you, start the platform for you, and you have to get on board. And thalassemics need to be seen, need to be heard, not hide away. I always say that if you are hiding your thalassemia, that means you are scared of your thalassemia. So if you are scared of the thalassemia, the public will be even more terrified. So how are you going to assimilate yourself into the population if they do not have confidence in you at all? That you yourself are so terrified of they are so ashamed of your thalassemia, you dare not let it be known. But if you can tell the world that I'm thalassemic, but I'm okay, I'm healthy, I might be even healthier than you all because we are so well monitored, right? And I can do a job. I will not take time out if necessary from work unless it's in emergency. And that's where we need the authorities to come and work with us for a regime that their work life won't be disrupted if they want to be to the thalassemics to be assimilated. All right. So thalassemics, it's your turn now.
You see?
Go on.
To me, patient and parent, I think I prefer patient, actually have powerful voice, you know, because they live in the reality of thalassemia every day. And then the experience actually provide the human perspective, even the statistic cannot capture it. You know, when we sharing our story, actually it can raise the awareness, and then at the same time reduce the stigma, and then help the communities to understand more about us. And then I just shared last time during the conference, when the minister come, there's one time that we actually he want to go back actually, and at that time on in the elevator he stopped everyone. At the time only patient, I just want patient together with me in this elevator, so all the reporter, the doctor step outside of the elevator. So it's like he want to listen our voice, the patient voice itself. You want to know what the problem that we face, what we need, everything that we need. And then it shows that actually we have a powerful voice. And then I still remember the federation itself, the Ministry of Health invite federation to involve in national CPG because they want to know patient opinions. So it shows that it is really like they need patient opinions in to provide the better management for thalassemia in Malaysia. So I hope other country will get the same opportunity like us, because that's the only way how we can, influence all the policymaker in getting a better treatment for thalassemia patients in our country. Yes, Kim, anything you want to add?
Yeah, no, actually, I want to read out a comment from the chat. Omar actually said, for starters, if the blood taking can be done after office hours, it will actually ease half of the burden of taking leave, which is very true. Yeah, because the blood grow and cross match and full blood count has been done before the day before your transfusion, at least no more than 48 hours, right? That's how long it lasts. So yeah, so it means that we have to go down 2 days to the hospital to do the blood work. Yes. Okay.
So that should be part of our wish list.
Yeah. Yes. No, I'm also just thinking of the healthcare workers, the medical professionals, because if we were to ask for after office hours, means they have to work extra hard, right? So there's always two sides of a coin.
Yeah, the ministry should do something about it.
Yeah. Okay. So it's up to policymakers to
Yes.
do something about it. Yeah. I don't know how. Well, I think yes. Patients' voice should be loud, right? Because it involves us. So we need to say something. If something is not right, we have to speak up. I think it's come to a point that every time I speak out, I think, oh no, my doctor's gonna get angry at me.
I can recall one incident when we first pushed the thalassemics in front. Right, that was in 2019, our first conference in Sabah, and everybody was very upset with me because when the minister came for the opening dinner, right, I didn't allow anybody to sit with the minister except thalassemics, and I was the most hated person in the whole room. Because all the department heads wants to sit with the minister. But that really turned the page, because the minister realized that all these are thalassemics. They are all adults. They are making sense. They talk very intelligently. He couldn't believe that he's talking to thalassemics. He thought that he's talking to doctors and nurses, you know. So that really turned the page for Malaysia. So I encouraged all thalassemics in other countries, be seen, be heard. That's the only way to get yourself heard and to get policies changed.
Yeah.
Do you agree, Faza?
Yes.
Agree. Okay. We'll move on to the next question. Oh, there's another one. Dr. Lisa, I remember a powerful message by George during the talk in Kota Kinabalu that one's life should not revolve around thalassemia, something health practitioners should be mindful of. Actually, that would lead us to our next question. What advice would you give to young people growing up with thalassemia today? For me, the advice is you're not a thalassemic. As in, you should not live life as a thalassemic. You should live life as per normal, like what your friends are doing and everybody else is doing, right? So yeah, that is what I think my advice would be. What about Azad? Sorry, Madam Khoo.
Sorry, talking about George, the idol of all thalassemics, right? I heard him say many years ago to the doctors on the panel on the stage at one of the conferences, and he said, "You all are doing a lot of research and are giving us many kinds of treatment, but have you asked us whether we want those kind of treatments or not? Why don't you involve us in your discussion for treatments to see whether it's acceptable to us?" He said that many, many years ago. And I think it's at the conference in Malta, the TIF conference in Malta. So his message is to work as a team, not doctors on one side and patients. You take the treatment whether you like it or not. You know, it has to be compliance from the patients for the treatment to work.
Yeah, actually, I'm sorry, I was thinking there's a pause. Yeah, I was thinking actually, when doctor asked me if I want to do this, I want to do that, I want to do a lot of things because there's a lot of advancements right now with the treatment, with a lot of new meds coming up. And I'm like, no, I don't want. I'm happy with what is happening now. I don't need any curveballs to come in my way.
Yeah.
Yeah, so I think yes, patients should speak up if you're not comfortable with something. Yeah. Azza, do you have anything?
If you ask me what my advice, I would say that thalassemia may be part of our journey, but it's not determine what is our future. You know, you never let thalassemia define your potential as a human being. So just take a good care of yourself, committed with your treatment, and then seek support if you need it. So at the same time, you just pursue what you want to do, your education, your career, or personal goal with confidence. That's all. Just do what you want as long as you know what your limits.
Actually, we've been asked a lot of times, can thalassemics like do sports? Can thalassemics be athletes? Actually, you can, because there are marathon runners,
Yes.
thalassemic,
Yes.
right?
Yes.
People climb mountains who are thalassemic. I do diving, scuba
Well,
diving.
Faza climbed Mount Kinabalu.
But now cannot anymore.
Amongst us, we have mountain climbers. Yeah, so everything is possible.
Mountain climbers.
Wait. Yeah. So Dee has something to say. Thalassemic patient can live a normal life. Yes. Okay. My son, who is now 11, does sports regularly and tried many sports like taekwondo, gymnastics, and skiing that not even his friends had done. He's happy.
Yeah.
Don't keep asking again and again.
Very good. Okay. Yeah. So living a normal life.
I think Kim, let me put a point in. The parents have to allow the kid to be normal.
Wow, don't limit your
Yes, don't be so overprotective of your thalassemia kid that you wrap them up in cotton wool, you know. They have to be normal so that they have confidence.
Yeah, actually, last time when I'm still, secondary school, my parents quite overprotected. They not allowed me to do outdoor activities, running. But then once I did, when I climbed Mount Kinabalu, then oh no, I can do so many things now. Since like open my eyes, I can do anything.
Yeah, really, you can do anything and everything. If just like a normal person, just continue to live your life. Don't let thalassemia stop you.
You're just a normal person living with thalassemia, that's all.
Exactly.
Because I'm busy.
Adi, from
Preparing a magic potion, I'm packing up.
medical professional point of view, do you have any advice? I mean, you have seen a lot of patients, right? You have seen a lot of patients come your way. Do you have any advice from a medical point of view?
Yeah, for me specifically, really, focus on the treatment. I mean, like when it comes to young patients, some is actually often rebel, right, against the routine of transfusions and everything. So, yeah, I mean, like encouraging them to make sure that they do all of the treatment. And then secondly, the seek for the support function and also the community that also able to support them and motivate them as well. Because sometimes if they are alone, sometimes, especially now, the different generation is different, I mean, like, uh, Gen X is more to, do outdoor activities together, but now Gen Z and Alpha is like autonomous, like tend to isolate themselves. So that is when association of society comes in to encouraging them to be in the ecosystem and also seek for the support function because knowing that they are not alone in doing everything right. So yeah, different generation is kind of highlight because it's different treatment, and parents also needs to know how to deal with these new generations because it's different. Yeah, so it requires different approach as well. Yeah.
Yeah. Thank you, Adi. Hafiza says thalassemia should have knowledge about FEL and treatment. Yes, we should be updated about what's going on.
To be the informed patients, informed thalassemics. Yeah.
And that is why actually attending conferences, getting to know people, fellow fellows from around the world is actually important as well. Then you know what's going on in other parts of the world, right? Not just in your own bubble. Okay.
But Kim, sorry. The part that is most crucial to make sure that the thalassemics are focused on their management is actually peer support. And they have to talk to, you must give them a chance whereby they can come together as a social and they start to talk to each other and they will support each other. They make friends and they have their own cliques and they will support each other because they are in the same boat. You're all in the same boat and you all understand each other. The parents don't understand you. The parents say, it's so easy. Why don't you just go and do it? And actually it's not that easy. So it's only the thalassemics who understand thalassemics. So there must be very loose social functions, with no lectures, no treatment, just leave them in a room with some coffee, cakes, or whatever, and just let them talk to each other and kick all the parents and the doctors out. And they are, and they will start to talk to each other. And that is very, very important, I feel. I don't know. What do you feel as a thalassemia? I'm only a parent.
You're only a parent. No, actually, it's true. Every time we meet like fellow fellows, right? Actually, I'm very scared of the question, how much is your ferritin? because it shows whether I've been slacking or not in doing my desk role, right? So actually we keep each other in check.
Yes.
And that's quite important. Yeah. And then the next question is, how often have you done your MRI T2 startup, right?
And what's the values?
Yeah. So yeah, it's true. So you need a good support network community of
Yes.
fellow
But
fellows.
I think I agree with Aditya. The generation sometimes is a bit different, especially the new one. I noticed that. I'm not sure in other country, but I think in my center, the young generation, they prefer to be like isolate in their own world. They don't want to mingle with other patients. Talking compared to our generation who love to talk. When we see other patient, we talk non-stop until the doctor need to stop you. You better you shut up. You make this daycare like a market now. You always got called like that because we are too noisy. But now patients like with their own gadget.
Yes.
So
yes.
actually we need, I don't know how to do, but
That
they need exposure with patients around
I think
them.
that is not only for thalassemics, that's for the whole across the board. So, so I think if you do a social for thalassemics, right, for them to talk, you have to ban handphones.
At daycare.
Yeah. Ban all gadgets.
Okay, idea
Yeah.
for your next conference, okay? Okay, so Omar says, we, the patients, have a lot of ambitions and want to do more. We have the willpower, but sometimes the challenges that prevents us from achieving our dreams comes with the unstable treatment schedules. For example, shortages of blood supply that interfere with our plans. It's true lah. It's true.
Okay, shortages of blood. Faza, would you like to share what you all do? Like you all thank the blood donors and all that?
Since actually we give usually during World Blood Donor Day, we will give like when they do celebration, so we just come there and give at least show up and then say thank you to them, and then just some stat, I think Kedah, they give some donation. It's not donations, it's like a basket to give to the blood donors. Not only Kedah, other state also they do something like that, to appreciate the blood donor. Yeah, at least we need to do something like that, so that to make sure all the blood supply is sufficient for all the thalassemia patient. And like me, most because we very seldom facing shortage on blood supply. But usually if this situation happens, the blood bank will text us and send a message, can you at least promote or put on Facebook, social media, that we need this type of blood urgent. So that's what we do. We help the blood bank so that to make sure all the blood supply is sufficient for all the not only for thalassemia patient, for the whole hospital actually. Yeah.
Actually, our Singapore Red Cross has been doing a lot in terms of this blood donation drive. They do go around Singapore to get people to donate blood. And especially during celebrating festivities, right?
Yeah.
Like for example, Christmas, Chinese New Year, Hari Raya. During this time, the blood is always very short because people are busy with other things. Yeah, so it's during this time that they do the push even harder. Yeah. Yes, we all have to show our best, try our best to show gratitude to all our blood donors. Yes, that's true.
I think what Fiza, my president, is saying. I mean, she has done a good job in that the thalassemics turn up to thank the blood donors. So, so the blood donors know where their blood is going, and they are very touched. You know that, yeah. So that's a very good.
I think 2 years ago, when they have a World Blood Donor Day celebration at our blood bank, I come and I thank them personally, and it's I'm the one that crying actually in front of them. And I said, oh, it's okay. We do it like sincerely for you all. I was like, okay, that's good. Thank you so much. I'm the one that crying in front of them. Seriously, we like we owe them our life.
Okay, let's move on to the last question. What does hope look like for the future of thalassemia care? What does hope look like for the future of thalassemia care? I don't know. Doctors, you answer this question.
Okay, let me start. Many years ago, one of the doctors who's now retired said to me when I first started the Penang Thalassemia Society, I said, I cannot afford to give everybody full dose of Desferal. I can only afford to give them a few vials a month or a box a month. And I've been told off that I'm giving thalassemics false hope because that is not enough, and there's not enough chelation for them. And I asked her, should I stop? She said, no, you should keep yourself as healthy as possible. That one box per month at least will remove some iron, although not ideal, but some iron will be removed. And you wait for the new drugs to come on the market. So now, presently, how many drugs do we have on the market? How many kinds of treatment do we have on the market? Some of them, like gene therapy, is very expensive, but it is here. I heard about gene therapy 40 years ago. So now it took 40 years for them to say, yes, we are able to do it, So I'm sure the price will come down as more people take up or more people are offering gene therapy. I'm sure the price will come down. So look at us today from 1980s, whereby the blood are not even filtered. And today everybody's getting red cells filtered, leukocyte filtered, and we are getting chelation, we are getting T2 star, Yes, maybe not all countries are getting that. But if we can do it, I'm sure, like I said from the beginning, we hope that all ASEAN countries will achieve the gold standard, at least the basic gold standard. So it's not doomsday, right?
Well, the future can only be up, not down, right? It can only go up. It cannot go down.
Yeah.
Adi, what do you think about this future of thalassemia care as from a doctor's point of view?
Yeah, well, I've been explaining things that the journey from the year 1980, right? I mean, like there are a lot of changes. Like now, information is getting better and better, and then the access for treatment also getting better. Now Indonesians, I mean, like have access for fully covered treatment. And yet, yes, there are still a lot of complications, especially when it comes to Indonesia. As I mentioned before, it's an island country. So the treatment and also the accessibility of good treatment now is not, equal from one area to another area. So they are still inaccessible areas that didn't get as good as the big cities like in Jakarta. So, however, that is actually something that we still keep on advocating. So there are two main things that I can see here in regards to the hope for care. The first one is the focus on curing, right? And the second one is the preventions. Yeah. So both needs to go along. And I can see high hopes. I mean, like, we can also Indonesia also experiencing if I'm not mistaken, the first gene therapy in late 2025. We did the procedure for a 15-year-old, and it was successfully performed as well. So, yeah, so I can see the direction is it's going to the right direction. Yeah, even though again there are a lot of challenges towards there, but I can see that the statistic is going up, sometimes down a little bit, but it's going to a better direction. Oh yeah, another thing, I also have data in Indonesia as well. In the back days, we definitely have issues, the availability of hospitals that doing the thalassemia treatment, right? Now, as I mentioned, the total patients like 5,068 patients. Now there are about 127 hospitals, thalassemia center that being improvised. So the government and also the private sectors already see this as something that the main necessity to improvise. Because when I visited several hospitals, I can see the difference between thalassemia center and another center. Thalassemia center is better. I mean, like it's great. It's amazing thing basically. But even though there are still a lot of things that need to improvise, yeah. And but the challenge is more to the hematologists, yeah, the specialized doctors that's still quite limited. And another thing, oh yeah, the I mentioned that there are two: care, cure, and also prevention. Indonesia also, the government also started to do the screening program. Yeah, is one of the government agenda to do the screening. And yeah, the direction is actually quite promising. Yeah. All right.
Screening, do you mean the prenatal screening?
No,
Yeah.
Okay,
Sorry again?
no,
prenatal.
no.
When you say the screening, when you say the Indonesia is doing the screening, do you mean the
Yeah,
prenatal screening or the pre-marriage counseling screening?
yeah, the primary counseling screening. Yeah.
Okay. Okay. So the Indonesia is talking about prevention and also curing. Yeah. Okay.
Yeah, because
Um,
thalassemia is the top biggest expenses on the national insurance. Now it's the other way around. We are the one who actually, chasing the government. Now it's government is actually chasing us, us to do something about it because yeah, it's the top five highest expenses for the national insurance. Yeah.
okay. In the people in the audiences, if you have any questions, you can feel free to either raise your hands. I don't know, switch on your video and switch on your mic and then talk to us, or you can put your questions in the chat. We are at the Q&A section already, so if you have questions, please type it out or speak out.
Kim,
Yes.
can I
Yes.
ask Adit a question? Adit, how do you all manage the insurance to get the insurance?
Uh, well, it's simply go to the national insurance apply, and then
The
there are
national
list
insurance is under the government or private?
under the government. Yeah, we call
Okay.
it BPJS. Yeah, BPJS is the national insurance, and everyone have the access to that.
Okay. It's
Yeah.
different from the private because we don't have insurance under the government.
Oh, okay. Yeah, there's monthly fees, but it's very low. It's very affordable. Yeah.
Yeah.
Mm.
For us in Malaysia, because the thalassemics are not covered by insurance, right? Treatment is free for us in Malaysia. Just a very small token that like blood, chelation, everything is free. But when they get a job, that's where the problem is because the company is not able to cover them with insurance. Faza, your input?
No, also not included.
Yeah,
Means-
not.
Yeah.
insurance. Yeah.
The company don't cover them for Thal related, right? But if it's
No, they
related,
because the awareness is still not there. So they just said that, oh, since we can't get you insurance, we cannot employ you. You know, so we need to work with the health ministry to come up with a guideline that if they employ thalassemics, they don't have to cover tau related issues.
okay. Okay, I'm going to read out what Ma Dahlia said. When talking about the blood donors, maybe this is an idea we can bring it back to our associations. We are doing meet the donors with our community. This really helps. And also hoping and praying that the Philippine thalassemia community can achieve even half of the accomplishment of our neighbors. You will, you can, you just have to advocate for it. It's very difficult work. It's very hard work. But yes, you can do it.
The thalassemics have to be active.
Yeah.
You cannot depend on all the doctors to do the work. It doesn't work.
Yeah. Yeah. Because you're the one who needs it, you're the one who wants it. So you have to advocate for yourself. It's not easy, I have to say. It's really not easy. Be prepared for a lot of hard work. But yeah, you should
just keeps on going. No matter what, just keeps on going. Yeah. That's the key.
It's true. Wow, okay. Shikin. I received my first blood transfusion 35 years ago. At the time, blood filtration was not available. NET testing had not yet been introduced, and optimal chelation treatment was beyond the reach of many patients because the medications were so expensive. Yes. I'm truly grateful that beginning in 2007, the Malaysian government provided free chelation medication, making a tremendous difference in the lives of patients like me. Sincere thanks go out to Madam Sui Hong and her dedicated team, yes, for their tireless efforts and commitment to improving the quality care for patients, especially in Penang, Malaysia. Your hard work has brought hope, better treatment, and a brighter future to so many of us. Thank you for everything you've done. Yeah. So you see, it's a lot of hard work, but it benefits people.
And now I have a target on my back.
Yeah, okay. So keep your Q&A coming in while we are waiting for questions to come in. Maybe Madam Khoo, you would like to get ready to close this whole session.
So do you want me to close now?
Yeah, well, okay, another one. Dr. Lisa, I'm curious, Madam Sui Hong, if the government is not the one who actually supports treatment, who actually pays for the medication or care-related expenses?
No, the government is supporting. It's just the government, we don't have insurance.
The private insurance?
Yes, yes. But everything else is supported by the government. So we have perfectly very healthy thalassemics that is very difficult to get into the private sector. If they get into the civil service, it's fine. But if they get into the private sector, a lot of them can't cover them with insurance. They can't employ them. Yeah. So it's a double-edged sword.
I understand. Okay, any more questions to come in before we close?
I think another hope that we need to put in mind is that access to all treatment, equal access to all treatment for all thalassemia patients, no matter where you are.
Yes.
Access to quality cares, the treatment, and also the support.
I would encourage all thalassemics to try to get yourself into one of your regional meetings or conferences or workshops, because you need to empower yourself with knowledge. Then you can go back and ask your doctors. So once there are questions about needing certain kind of things, then it gets the government thinking, because if nobody asks, they can just ignore. But if somebody brings up the subject, they have to address it. It's just like when we asked for NET tested blood. I went down. I was told by my doctor to fly down to a meeting and ask for NET tested blood, right? But I'm not a thalassemic. I'm a parent, and I was told to shut up. Don't ever mention NET tested blood again. Okay, so the next meeting, I got thalassemics to stand up and say, so when are we getting net tested blood? So a few years later, they got their net tested blood. So the thalassemics are very powerful. You need to speak up. You need to be seen. You need to form your own society because a single voice is not powerful. You need to represent all the thalassemics in your region, in your hospital, in your state, in whatever, and then you speak with one voice and you go and meet the authorities in one voice. Because one single voice won't be heard. You need the whole group. Yeah, so we start small. You don't have to start like this ASEAN thing is like very mind-boggling for me. So we start small in your own hospital, and then you can ask a region to join in your state, and then you have the whole country, and we try to do ASEAN.
Yeah, Omar said collectively we ASEAN must get together and voice our concerns together.
Yes, and we can, once we have the ASEAN as a strong body, we can negotiate with the pharma companies.
Actually, that's what we are trying to set up ATF for, right?
Yes,
Yes.
That's right.
Okay, I think we can get ready to close. It's 8:45.
Okay, so let's talk about hope. Is there hope for thalassemics? For me, so long as you're breathing, there's hope. Right? The minute you stop breathing, that's the end of the story. So long as you're breathing, there's always hope. So never give up. Never, never give up. Thalassemia is no longer a death sentence now. You have so many kinds of treatment available, and expertise are now worldwide and it's easily accessible. So, but as I'm going to say it again, the thalassemics have to empower themselves with knowledge so that they can talk sense to the doctors. And with that, the doctors you can work together with the doctors as a team. Yeah, you just have to keep yourselves as healthy as possible. Never neglect your management. Don't miss your dosage of medication. Don't miss your appointment for blood transfusions. We used to have horror stories of when they allowed their blood to drop until HB3 before they crawl to the hospital for a blood transfusion. But as I said, thalassemics need a lot of peer support. They need a lot of peer support. Without that, they will not survive. Because if they're isolated, they will think that it's too tough a fight. But if they know that there are other people in the same boat and they're doing well, then they feel better. They feel better. Before, long time ago, I used to say, what's wrong with thalassemia? All thalassemics boleh, and they are like, you can do it. All thalassemics can do anything. And they were all looked at me shocked, can they? That sort of thing, So Thals have to be brave. You have to be bold. You have to stand up, be seen, be heard before you get what you have, what you need. And you need to get your government to be more proactive in screening and awareness. Screening is very much needed. You have to keep the numbers down. If not, the whole country will go bankrupt. Just treating thalassemia with the drugs and all that, right? Awareness to remove the stigma of thalassemia. That's all I have to say. I think I've said more than enough.
Yeah, thank you, Madam Khoo. Yeah, Sumira said, I hope my patient can take iron chelation and their medication, follows the schedule, don't miss. Yes, taking chelation is actually very important for health. Yeah. Okay, thank you very much. If there are any more questions, you can feel free to either stay behind or to ask us questions offline, or can try and find. I mean, we have one of our contacts, I'm sure, so you can contact us. Thanks for attending this session. I think we hope to have more of these sessions, maybe annually. Yeah, so do look out for such sessions again and then come join us. Yeah, I hope it's uplifting. This whole session is uplifting to all of you. Thank you.
Thank you. Thanks, Kim. Thanks,
Thank you,
everybody.
everyone.
Thanks, Adit.